you ready?
I very long time. Good afternoon, and we are here again for another National Emergency Operations Center COVID-19 daily briefing for the 13th of April, 2020. Thank you very much for joining us today, as you continue to do each day to keep updated and informed about what is happening in St. Kitts and Nevis with respect to the COVID-19 pandemic or the novel coronavirus, as it is also called. We have been very fortunate in St. Kitts so far that we only have 12 confirmed cases, and the stress here is on the confirmed. Several persons have been tested, and we keep testing here. We have had no deaths. There is no one hospitalized, and that is to be commended. But we cannot let down our guard. We cannot act in a cavalier manner. We cannot become complacent. We're hearing that in some places, for example in China, there are new infections or people who it was thought had recovered from the COVID-19 virus are again presenting with symptoms. An investigation is being done to see whether they are newly infected or it is some reactivation of the virus. These are just terms that they are using. In the Caribbean, we cannot fool ourselves. There are deaths happening in the Caribbean, maybe not on the scale that it has happened in China, Italy, Spain, the UK, the United States. But there are deaths happening. Let me read some statistics. Our neighbors next door, both Dutch and French St. Martin. Dutch St. Martin, there are 50 confirmed cases. They have had 9 deaths. On the French side, they have 32 confirmed cases, and they have had 2 deaths. The Dominican Republic, which is also within the Caribbean, our neighbors as well, they so far have had 3,167 confirmed cases and 177 deaths. Just today alone, they had an additional 200 confirmed cases. Antigua has 23 confirmed cases and 2 deaths. Martinique, our French neighbor, 157 confirmed cases and 6 deaths. And our next French neighbor, Guadeloupe, 143 confirmed cases and 8 deaths. Barbados has 71 confirmed cases and 4 deaths. Cuba has 726 confirmed cases and 21 deaths. Jamaica, 72 confirmed cases and 4 deaths. That is over 230 deaths in the Caribbean. And that is not exhaustive of all the countries in the Caribbean. So we are not immune in the Caribbean to people dying from the novel coronavirus. It was said that black people were immune. That was one of the myths. But what you're seeing in the US is that a number of black persons are dying. In some of these areas, a number of black people are dying. We here in St. Kitts, we have no deaths thus far, and we are trying to maintain it this way. Without further ado, I would invite Mr. Charles Paris, who is the Director of the Water Services Department, to address us. Mr. Paris.
Good afternoon, all. Today, one of the main recommendations made by health officials around the globe is that proper hand hygiene saves lives. This is critically important in our fight against COVID-19, a deadly virus that has spread throughout the world and wreaking havoc on everyone who is unfortunate to receive a visit from it. Now, here in St. Kitts and Nevis, we are quite fortunate that we haven't had some of the devastating statistics as some of the larger, more developed countries. And we would like to do our part to keep it that way. Now, soap and water. This translates for me at the Water Services Department, for my team, an increase in usage that we have already begun to observe, especially now that we have more persons staying at home during the days. They are heading to the taps more frequently, and as such, this will inevitably mean an increase in water usage. So, we want to make sure that here in St. Kitts and Nevis, fighting this COVID-19 doesn't bring about another crisis. Unfortunately, some of those challenges that water has faced before, the pause button was not pressed and said, oh, we will allow you to deal with COVID-19 and then you could come back to us later. We still have those same challenges to deal with today with regards to climate change and how it affects rainfall and weather pattern. They are still very much a reality for us. And so, I'm here today taking this opportunity to ask you, the general public, to continue to stand with us as we fight COVID-19, to remain conscious of how we use water. When you're at home, do not allow the tap to run for any longer than it has to. Instead of full bore from the tap, you could reduce the flow when washing your hands. So even if, and we would rather that it not happen this way, but even if the tap must run while you're washing your hands, it doesn't run at full bore. For 20 seconds, as they are recommending that we wash our hands for. At 20 seconds, at full bore, that's almost 1.5 liters of water that can go. All right? If it's reduced, probably an 8-ounce glass could do the same task. All right? So, we must remain vigilant in this way. Now, understanding that we still have the challenge of the seasonality of our rainfalls and stuff to deal with, the Water Services Department and the team, they're out there vigilantly monitoring our water supply and storage infrastructure. We want to make sure that every single day, to meet the daily demands, the daily daytime demands, water would be there for our citizens and all the consumers around. So it may become necessary at times as a proactive step for us to shut down or ration water in some areas. As I say again, the reason the increase It's a significant increase as everyone is at home, using water for every number of reasons, and more frequently heading to the tap. So we want to make sure that during the day, which is in this situation very critical, that everyone has that supply that they could depend on. Now, some citizens in the Sadlers, Dieppe Bay, Lodge area may have already witnessed a rationing of sorts. And this we are now doing voluntarily as a proactive step so that it doesn't have to be forced upon us in the future. All right? So, as I stand here, I'm asking again, as we stand unified in the fight against COVID-19, we at the Water Services Department will continue to do our best to make sure that water is in those taps for you guys. And we want you to make sure as well, when it gets to you, you do your best to manage it as good as you can. Every drop saved can go towards proper hygiene for yourself or even your neighbor. And in extension, the health of the Federation of St. Kitts and Nevis. So today, I'm asking, I'm pleading, and I'm letting you know that more than ever, we need to adopt certain water conservation habits. We can use containers to capture water from the kitchen sink and give it a second use. So if you must water a plant, that water could come from the used water from the kitchen sink and not from the fresh potable water that we would have for use otherwise. Please forego some of the non-essentials for now. Washing your car. If you're at home and you're bored and you feel like you need to do something, let it not be washing the car or the vehicle. All right? Anything at all that could reduce the volume of water that you use to save it for the next day, we would want you to embark in that habit. The Water Services has also established a hotline. I think the number is 762-0099. Any water-related issue that you may encounter, please dial that number, and a representative from the Water Services Department would do their best to assist and address whatever the issue is. Again, everyone, we are in some unprecedented times. We do not want this battle against COVID-19 we can't lose. And we must be very, very observant, very conscious, very aware of every little thing that we do regarding water. All right, so today, that was just me taking the opportunity to remind and continue to encourage those to keep on the path, and we should overcome this very deadly virus in good standing. I think that is it for now. Stay safe, everyone. Stay at home, and only if it is a must should you venture outwards. All right, thank you very much. Yeah.
Thank you, Mr. Paris, for sharing with us. We cannot underscore enough the importance of having clean water, potable water in our homes and so on as one of the measures to protect, or the greatest measure to protect against the COVID-19 virus, of contracting it, has to do with hygiene and washing one's hands. We here in St. Kitts and Nevis, we are fortunate in the fact that we have water. But think of some places in the world where they don't even have access to water. They don't have clean water. Hygiene then becomes a problem. And therefore, with this COVID-19 virus, then that can amplify that problem in terms of the spread if you don't have water, for proper hygiene, basic hygiene, such as washing one's hand. I now invite Dr. Isme Taylor who will speak to us on philanthropic matters. Dr. Taylor.
Good afternoon and hi everyone. Mr. Williams, thank you too for inviting me. I'm, well, as he said, Dr. Ismay Taylor, a university professor and dean, retired. And I'm here partly in time of, partly for my family's foundation, the Keynes's Family Foundation. I'll make a presentation and I'm happy to be here. Greetings and much respect to those of you who are listening by means of technology, whether you are at home or abroad. I consider it a privilege to greet you here at this daily briefing. You will permit me, I will use these few notes, not to encourage the expansion of my remarks, but as an anchor to keep me nailed down to the short space of time. Yes, Mr. Samuels, who called me up to this, Mr. Samuel said that I've watched the daily briefings, which is true, and I have gained much respect for the ability and good sense you and your team, your entire NEOC team, have brought to your work. My thanks. Allow me to, however, shout out appreciation to the medical and health component. Dr. Laws, Dr. Wilkerson, Junior Minister of Health Wendy Phipps, with the others from the Health Ministry. To you all, I extend kudos for your consistent dedication and your professionalism in keeping our hope, that is the public, keep us in the public, alive as you report and educate us with timely information that you garner as you maneuver through the uncharted waters of this epidemic malady of a pandemic magnitude, the coronavirus. Dr. Laws, I recognize fully the great service you are giving to the nation. You are blessed with an irrepressible spirit and dynamic energy, transmitting your powers to others. May you continue to enjoy splendid health. Since I'm here to answer a call to the national response, I would like to first render a somewhat freestyle ideology of my comprehension of giving. Well, giving is a component of our DNA. All of us have this in our DNA. I call it the 3 T's of happiness. It's your time, your talent, and your treasure. Interestingly, this component of our DNA has the potential to do good or evil. For somewhere in our brain cells, there's a functionary which acts as a thermostat or thermometer. It will measure and dispense the happiness triggered by that giving component, whether it be the use of your time, your talent, or your treasure, whether it be individually or collectively. This phenomena will affect the giver as well as affect the recipient timelessly. I'll tell you quickly of one of my own experiences of how this effect and affect infuses. My father, Moses Keynes, a 20th century man, born March of 1900, deep Beirut, died at the age of 78 years. He lived through 2 world wars and 2 significant socio-economic upheavals here in St. Kitts, namely the Butkless riots and the Great Strike. That giving component came to me through my family, but very early, nothing to understand at that age. Father, I understood, as I understood it, was a carpenter, and he had a little food shop selling stuff. People from the village would patronize, obtain some food on their card, then remain to socialize, laughing, joking, and planning. My father had the biggest laughter. I thought he could rock the tins and the tin stuff off the shelves. I must have been about 3 years old when I realized that father had a talent which he loved and which was sought after. He was the village expert that you engage when you had to cut a house in 2 parts. For those of you who have forgotten, or those of you who didn't know this, in those days, a person could leave his will in a house for 2 persons. The way they resolved that was to engage a person like Mr. Keynes to expertly cut that house down the middle from the roof to the floor. Then each person would move away her half on a truck or on a composite of pushing and rolling barrels. Sometimes half could go to Parsons Ground and the other St. Paul's, which was where the new owners lived. The land was not owned by either of these. I would have heard then that there was no charge from Mr. Keynes for the cutting. Father would say, "Lord, Lord, the person can't afford it. Leave it so." But my mother, Mrs. Keynes, would pass the day making a big pot of food for the helpers to gather, to eat, drink, and show off their happy laugh when that was all done. The crisis of the World War II and the economic impact ruined the little shop business of my father. The customers had no jobs, no money to pay the debts that they accumulated for the accredited food, and obviously the owner had no money to buy a restock. So Moses Keynes then moved with his wife and 5 children from Dieppe Bay to Bastille. After moving around some time in Bastille, he settled in Central Street, McKnight. That's where I grew up. Here in McKnight, the parents added 3 more siblings. Mother Keynes was an economist before we had learned or even knew words or understood words such as economic systems and logarithms, because she thrived on a philosophy of giving. Hers was give, share, put something back. The Lord will bless you, and it will bless your children. Her mantra was, cast your bread on the water, and you will find it many days after. For us children, that would have been we couldn't understand. Mother always knew someone in the Cardin home to send a dinner to. And one of us children would have to take that dinner there even before we could get to eat our own dinner. We couldn't understand this. And you'll imagine this would have been a moment for a long face or even a thought of a stoops. We would be told, run, go, and come back quickly. You're casting your bread on the water. Or convincingly imposing her belief, she would surmise, I'm casting my bread on water so that you will find it later. Okay, fast forward. We moved to Greenland, one of the first families there. Then we grew up, got jobs, then scattered, settling down, making our own families, and settling, whether it be at home or abroad. And then, soon everything began to come together. We began to understand the meaning of the figurative cast your bread on the water. The giving, give, share. And we understood the happiness in return. We could really see clearly now, because then the blessings were coming in. Now, 20 years ago, retirements began to set in for the children of Moses and Mary Keynes. With much reflection and reflecting, we concluded that Moses and Mary's ideology of giving was time-tested and rightfully had to be honored. And the stories that the stories had to be passed on to the next generation. Thus, in June of 2007, the founding of the Keynes Family Foundation was realized, and this was to their honor. The principal founders, principal donors were Mr. Richard Keynes, accomplished and recognizable businessman, Dr. Isma Taylor, educator, that's me, Dr. Stanley Everton Keynes, a diplomat of the American Board of Internal Medicine with a specialization in cardiology, and Troy Taylor, vice president with worldwide responsibility for the laboratory automation system product with Clinical Diagnostics, and that is a Johnson & Johnson company. The Keynes Family Foundation, with their goals and aims, and I'll state that as I quote, I'll state the goals and aims of the family was as follows. The Keynes Family Foundation was organized to assist in the improvement and enhancement of education initiatives, strengthen economic development, and promote healthy families in St. Kitts and Nevis. The goal of the foundation is to facilitate training and expert resources in the areas of management, leadership development, business development, health-related issues to educators, business entrepreneurs, and health and medical practitioners. The foundation has been accomplishing and continues to accomplish much of its goals. The foundation is no stranger to the Ministry of Education, and its input and involvements are documented. Dr. Stanley Keynes, Everton, we all know him, was the health connection, the health designee from the foundation to the ministry. Sadly, we lost him 5 years ago, all too soon, at the age of 61. This is the cardiologist who succumbed to cardiac complications. Today, Dr. Keynes' spirit hovers around us, and I have come to give my support to the fight against this virus. Mr. Samuels, are you here? Would you come, please? My head tells me that your committee is stressed with the ever-changing, fluid nature of this crisis. Things happen in real time, which means that there are real-time occurrences and events for which there is no inclusion in your budget. Thus, as the chairperson of the Keynes Family Foundation, my heart tells me that on our behalf, the foundation is pleased to present to your committee this initial check of $10,000. $10,000. I have a little more to say. For information, I have, well, thank you, Mr. Samuels, and good use. You know where to use this. For information, I have an email which just sharing with you the work of our ambassador in Washington, Dr. Thelma Brown. She reached out to some Kittians in the diaspora on behalf of our nationals who are students in the USA, in universities, and who have called on the embassy for help. I see that the response to her communique garnered, well, I have 3 persons here I have knowledge who took the helm of this thing, one being Ms. Jean Herbert Walters on behalf of Ruth Liebert Foundation. And then there was Larry Quinlan, another Kittitian. And then Troy Taylor from the Keynes Family Foundation, who is my son and lives abroad. And they immediately reached out to our students wherever they are in the US. And my information is that they reached out to over 80 students. And I also heard that they have transferred among themselves these Kittitians abroad, these 3 names I mentioned, that they have already sent over $8,000 of money transfer to help our students who some are displaced because of this virus. So I'm glad to hear that. I see that our nationals are stepping up. I also must mention that I see individuals locally who are showing up and doing a part. And there was a Mr. Brown last week who I saw. And Mr. Brown, you broke my heart. You stirred me, and maybe that's why I'm here. It was time to show up, because there's room for more of us to show up. There's more that we can do. Some islands are having telethons, and there are lots of things that we could do. I'm entreating now, I would like to entreat others who may still be contemplating. Stop contemplating, stop contemplating, get on board. We each have to do our part, because we are all of us together. All of us are in this together. We have to fight for our lives. And guess what? The life you save might be your own. I'm entreating others who may still be contemplating to step up and show up. Once in a great while, a cause so tragic in intensity and so overwhelming in importance is brought to our attention that it transcends any consideration of creed, race, or political affiliations. COVID-19, an invisible, deadly virus, a pandemic of epic proportion, it surrounds us. This is a cause that merits the support of all of us. We are grieved, yes, and we are grieving. But hello, grief is not the greatest loss in life. The greatest loss in life is what dies inside you while we live. We cannot buy happiness. We can't go to the nearest supermarket and order a pound of happiness like you would order a pound of cheese or a pound of butter. Happiness comes from within. You can secure a measure of happiness by your own acts. You can find that feeling of contentment when you respond to a struggle, any struggle that you find yourself faced with. Again, I think this opportunity, and I take this opportunity to appeal to all my fans. We all have a personal responsibility to ensure the fertility and fruitful life of future generations. All you fans of Teacher Ismay out there, whether you're at home or abroad, get on board, show up, do your part, whether it be big or small. Remember the 3 T's? Time, talent, treasure. Bring what you have, how much you can. Let's save our nation for the next generation, please. And may life treat you as kindly as you regard it. Kindness and love are the 2 highest expressions of God. Thank you, and may God bless us all.
Thank you, Dr. Taylor. I would sum up your address in 6 words. Give of your time, talent, and treasure. And another 5, give, 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 give. How much was that, 5 or 6? I would now invite the Chief Medical Officer, Dr. Hazel Laws, to address us.
Good afternoon, everyone. As of today, Monday, the 13th of April, 2020, at 3 p.m., the World Health Organization reports 1,773,084 confirmed cases of COVID-19 globally, with almost 112,000 deaths. In the Federation of St. Kitts and Nevis to date, 233 persons have been tested, with 12 confirmed positive, 177 confirmed negative, and 44 results pending, with 0 deaths. There are currently 29 persons quarantined in a government facility, while 113 persons are quarantined at home. 12 individuals have been diagnosed with COVID-19 and they remain in isolation. To date, 552 persons have been released from quarantine. Now, the Ministry of Health have been receiving or getting questions about COVID-19 and pregnancy. So this afternoon, we want to reach out to all those pregnant women who may have questions regarding COVID-19 and pregnancy. Now, the current evidence is not clear about the impact of COVID-19 infection on pregnant women. Despite limited data, at present, there is no evidence that pregnant women are at higher risk of severe illness than the general population. However, due to changes in your bodies and immune systems, pregnant women can be highly affected by some respiratory tract infections. It is therefore important that you take precautions to protect yourselves against COVID-19 and report possible symptoms, including fever, cough, or difficulty breathing, to your healthcare provider. Pregnant women presenting with symptoms of COVID-19 will be prioritized for testing. Pregnant women should take the same precautions to avoid COVID-19 infection as other persons, including washing your hands frequently with alcohol-based hand rub or soap and water, maintaining a minimum of 6 feet physical distance between yourselves and others, and avoid overcrowded spaces. Avoid touching your eyes, nose, and mouth, and practicing respiratory hygiene. It is still not known if COVID-19 can be passed to the child during pregnancy or delivery. Additionally, the virus has not been found in samples of amniotic fluid or breast milk. All pregnant women have the right to quality care before, during and after childbirth. The staff on the maternity wards in St. Kitts and Nevis have been sensitized to the guidelines regarding the delivery of care to pregnant females who are COVID-19 positive. For COVID-19 positive new mothers, please note that close contact with your baby and early exclusive breastfeeding helps your baby to thrive. You should be supported to breastfeed safely with good respiratory hygiene. You should be supported to hold your newborn close to you, skin to skin, and share a room with your baby. You should wash your hands before and after touching your baby and keep all surfaces clean. If you are too unwell to breastfeed, you should be supported to safely provide your baby with breast milk in any way possible. This provides a summary of basic information on the topic COVID-19 and pregnancy. I want to remind our listeners that national statistics and other COVID-19 related information can be found at the official website www.covid19.gov.kn. Hashtag stay safe at home. I thank you.
Thank you, Dr. Laws. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to address us.
Thank you very much, Mr. Williams, and good afternoon, listeners and viewers of this broadcast. This afternoon, I'm going to update you on law enforcement activities and over the past 24 hours. To date, we have made 57 arrests of persons who would have violated the curfews, the 24-hour curfew, 7 on Nevis, 50 on St. Kitts. 39 persons have been charged, and the others have been informed that they will be reported. The police are investigating the circumstances surrounding an incident which occurred in Keon this afternoon around midday. We had 3 persons who were wounded and were transported to the JNF hospital, where they still are being treated. One suspect in this incident is in custody, assisting the police in their investigation. What is important to note is that this incident started through an alley in public space, which is in violation of the curfew. I again remind citizens that we are in a state of emergency, where a 24-hour curfew has been imposed and is currently in effect. This means that persons are to remain confined to their places of residence, inclusive of your yard space. Persons should only be in public spaces for specific purposes, such as attending or accessing medical attention in case of emergencies, if you are an essential worker who are on your way to work, or if you are specifically exempted by the Commissioner of Police in writing. This particular incident is under investigation, and appropriate charges will be laid upon completion. The Professional Standard Unit of the police force is investigating a number of reports that have been made by citizens against the police. Number of reports against the police made by citizens. These reports have been documented and would be investigated by the appropriate department and will be resolved appropriately. I again want to reassure citizens that our officers has been asked to always respect each individual and to only use whatever force is necessary to achieve the particular objective at the time. We also remind citizens that they have a responsibility to always cooperate fully with the police and to comply with whatever directions that they are given. Even if you think the police is wrong, do not resist. Always comply and then complain. I would again take the opportunity to remind citizens to stay off the street, observe the curfew, and only be outside if you are permitted. Previously, I've mentioned that driver's licenses, temporary driver's licenses, can be renewed at the traffic department in St. Kitts, traffic department or the fire services in St. Kitts on partial curfew days. I started to get calls from persons in Nevis about what is the situation in Nevis. I'm pleased to announce that this privilege is also extended to persons in Nevis who wish to renew their temporary driver's licenses. You can do so at the Gingerland Police Station or the Charlestown Police Station on partial curfew days. I just want to bring to the public's attention, in closing, a provision in the emergency powers regulation on restrictions on visitations. No person shall visit or be permitted to visit any place of quarantine or isolation. So at the government controlled isolation facilities, or if a person is quarantined at their home or isolated at their home, no person shall visit these persons at these locations. B, a patient in a hospital or residential care establishment or facility, including an elderly nursing home. And C, a detainee in prison. So just to recap, restriction on visitation: no person shall visit or be permitted to visit a place of quarantine or isolation, a patient in a hospital or residential care facility, including an elderly nursing home, or a detainee in prison. I want to thank you for listening and continue to urge your support and the full cooperation with the police. Thank you.
Thank you, Superintendent Henry. Every day we have a number of people here who give of their time, who make the additional sacrifice to come and ensure that you have the information, that your questions are answered. Some of them are Dr. Cameron Wilkinson, the Medical Chief of Staff, who is here with us, our Attorney General and Chairman of the Disaster Mitigation Council, and the Honorable Wendy Phipps, who is our Minister of State with responsibility for health. They are here at almost every briefing. We also have the Commissioner of Police, who is with us, Mr. Hilroy Brandy. They are here, of course, to offer support, not only support, but to help answer your questions. I now invite Mr. Abdias Samuel, Chair of the COVID-19 National Task Force, to address us.
Good afternoon to all of our listeners who are tuned in via radio, television, and the internet. The situation report for today, Monday, 13th April 2020, is as follows. First, let me acknowledge the St. Kitts SKN, which is the St. Kitts Nevis Comprehensive Disaster Management Youth Ambassadors, for the kind donation of non-perishable items and toiletries. It is important to see our youths in action. We also want to thank those who continue to give food hampers to the vulnerable, and persons who are willing to do so, please do so via the means of the National Emergency Operations Center, the NEOC, or social services. 311 hotline. Federally, we had 68 calls, 59 on St. Kitts, 9 on Nevis. 911 would have processed 107 calls for the past 24 hours. The NEOC, the NEOC, processed a total of 17 calls, and 8 on the EOC and Nevis processed 8 for a total of 25. And these calls were as follows: 9 requested permission to be able to travel during the curfew hours, 3 were health related, 2 general information, and 3 for assistance. Before I move on, I just want to reiterate what I said before. What is the purpose of the 311 hotline? And there are 4 main purposes of the hotline. 1, the role of the 311 hotline is to assist nationals and residents of the Federation who are experiencing respiratory tract symptoms to call and access healthcare services. 2, to address callers with issues pertaining to individuals in quarantine or isolation. 3, to address questions related to health system operations, meaning the opening of health centers, etc. And 4th, and lastly, to link callers who may have psychosocial needs or concerns to the appropriate services provided. I am asking persons to use these 4 means that were expressed to you for the 311 hotlines. If you have any other concerns, please dial 911 or the numbers that you are seeing on the crawl at the bottom of your screen. Those are the numbers for the NEOC, 911, and any other. Again, Social Security continues to support, and along with the Labor Department, continue to support persons who are inquiring about assistance, financial assistance due to the impact of the COVID-19 on our economy. The Social Security hotline is 667-2535. 667-2535. The Labor Department on St. Kitts, 662-2075. On Nevis, 762-1099. SCELEC has informed that from the areas of Sir Gillies and Newton Ground will be experiencing interruption from the hours of 9 a.m. to 11 a.m. on Tuesday, 14th April 2020. SCELEC apologizes for any inconvenience of this electricity service interruption to those in that area. Please be guided accordingly. The Quarantine and Isolation Task Force continues their hard work. Today, they would have issued 10 notice of quarantine and isolation. What that means is that they have reached out to about 10 persons who are in quarantine or isolation, and they have had them sign their forms. This team has been doing an excellent job in enforcing the quarantine and isolation orders. Again, I ask of you to continue cooperating with this team. At this time, I also wish to inform you that we continue our efforts in protecting our borders. I come here day after day and sometimes report to you the repatriation flights that the United States of America is undertaking. However, I must inform you as well that we have refused a number of flights out of the abundance of great caution. We are doing well. Our health system, the health team led by the CMO and Dr. Campbell Wilkinson and others are keeping us in this tight concept of ensuring that we don't have any exponential growth of the curve. The curve is flat. We need to do our part. We are doing it. I need you to do it as well. Again, with that said, I want to thank the frontline workers, the discipline forces, the staff of the NEOC, and my staff here at NEMO, who day in and day out continue to function. Lesroy also mentioned something that is critical. The Commissioner of Police is bombarded on a daily basis. I don't think anyone wants to be sitting in his chair with the pressure that is surmounting on him. And for him to take his time to come and sit and show moral support is highly commendable. But what is more commendable to me, to see that the Mitigation Council Minister, the Honorable Attorney General, and the Junior Minister of State with responsibility for health, the Honorable Wendy Phipps, on a daily basis, they are here to support the cause and show moral support to the men and women of service to country at this critical time. I am appealing to all citizens and residents to please support the efforts of the police and all disciplined forces, from the very EMT that has to transport someone and the ambulance, to the very orderly that has to push that stretcher, to the very cleaner of all these health facilities, to every single clerk that is here working at the NEOC, to every single member that make it here from ZIZ. John James always is left out, but every day he's here on time to ensure that we have an early start. I think the country needs to thank them for the tireless work that they do on a daily basis to keep you informed. One of the things, the initiatives that we want to have in order to bring a sense of reality to you, is we are working on bringing our regional partners together during a special program so that we can share our best practices right here on ZIZ, so that you can see exactly the challenges that we are having throughout the Caribbean region, which is similar. But what is particular to St. Kitts and Nevis is the successes that we are having in St. Kitts and Nevis. Despite all the challenges, the successes of St. Kitts and Nevis are very measurable, and they are leading, I must say, leading the charge in terms of best practices in the OECS. So again, I want to thank everybody who is making this happen, and I look forward to the support of the general public in understanding what they need to do to protect each other and protect us as well as we try to protect you. Thank you.
Thank you, Mr. Samuel. It's question and answer time. The first question: it has been reported via the media that President Trump might fire Dr. Fauci. Who is Dr. Fauci? He is the head of infectious disease at the Centers for Disease Control, for being forthright about the president's response to the coronavirus. To Dr. Laws and Dr. Wilkinson, how can the nation be sure that you are not telling the Prime Minister what he needs to hear in an effort to lock down the country? Question number 2. Other countries like St. Thomas, etc., has partial curfews where the citizens can do what's needed to be done in the daytime. This helps to avoid the long lines at groceries, etc., reduce the numerous domestic issues that are currently occurring, and the mental stress that many of our citizens and residents are currently experiencing. Why are we treated so badly in the Federation?
For the person who asked that question, I think if you are following the international news, you will see that from the time the first case was confirmed in the United States, Mr. Fauci, or Dr. Fauci, was telling Mr. Trump that the country should be shut down, and he did not listen to him. We also saw that there was an exponential rise in the number of cases within a week after the first cases were diagnosed. If you compare that to our country here, after our first case was diagnosed, soon after that, we advised that the country be closed down, and it was closed down. After that first case was diagnosed, we were waiting for an exponential rise in our cases, but because of the mitigation efforts that we had done and all of the things that we had put in place to control the spread of the disease, we did not experience that significant rise. And I can assure you, as I said before, I've been working in this ministry for the last 23 years. I've worked through 2 different administrations, and I've advised 5 different ministers of health, and I have no other choice but to speak to the facts and the truth, and that's all I will continue to do for the rest of my life.
Thank you. The question was in 2 parts, really questioning why we don't have partial curfews like St. Thomas, and in the daytime so that people can go about and do their business and so on. Dr. Laws, would you like to take that?
Thank you, Mr. Williams, for repeating that question. And I just want us to remember that when this state of emergency was first announced, that's how it all started. It started with a curfew going from 7 p.m. up until 6 a.m. the other morning, and then individuals were allowed movement during the daytime, and then the curfew restarted at 7 p.m. But we all knew that this failed. Persons congregated at the beach, and they did not, the population did not adhere to the social distancing measures. And so regrettably, we've had to have a 24-hour curfew for an extended period of time. And this will continue until Thursday morning this week. And so yes, we have that was the first option that we tried, but we were unsuccessful in terms of having individuals adhere to the social distancing measures that we want. Thank you.
The data is actually showing that the United States Virgin Islands, of which St. Thomas is a part, has already recorded death. We have not recorded any death here yet. We don't want any death here. Okay, this question has to do with trucks that are hauling sand and dirt. Someone says that trucks have been hauling sand and dirt non-stop from down Otleys since last week. And the people are complaining, how is it that they are being allowed to do that and they can't go out to work? Superintendent Henry.
Sand and trucks hauling sand and dirt from Atlas, if that is happening and the persons who are doing it do not have permission, then it is unlawful. I know there may be some exemptions for certain government projects that has to meet certain timelines. I don't know if those are part of that project, but if it is happening and they do not have exemption, it is unlawful, and the police usually investigate these incidences once they are brought to our attention.
Okay. This question is from Sugar City, 90.3 FM. Good afternoon. Much mention is being made about self-employed individuals relative to the Social Security package. What about those self-employed individuals who we know it is unfortunate that they did not register as a self-employed business owner? Is there anything that can be done or any assistance that can be provided to them? For example, the fishermen who go out on their boats, those who braid hair and do massages on the beaches, as well as the guys who display the monkeys, who would have been given permission from tourism to provide these services. Second question. Last week, we were informed that backyard gardeners could pick up seedlings from the Ministry of Agriculture, but persons in Zone 1 weren't permitted to enter Zone 2 to collect these. Who will take those questions?
Good afternoon, everybody. Unfortunately, the Director of Agriculture is not with us today. And what I would say is that currently, the Cabinet will be reviewing the days when there is to be limited curfew, when individuals may leave their homes for very special reasons. We had hoped that that would be mainly for emergencies, such as visits to the hospital or medical facilities. More importantly, well, just as importantly, for food. And we did hear the Director of Agriculture indicate that for a short window, Monday last week, seedlings would have been available. That has to be reviewed, and we will be making a further announcement along that line. I want, however, to revisit a question that had been asked earlier, and it had to do with the question of why some of our neighbors had more unrestricted access to do their thing, and why we here in St. Kitts seem to be having a more restrictive position in order to fight COVID. And maybe we would, at NEOC, the National Emergency Operating Center, want to bring to you a comparative view of how throughout our region some of our neighbors are faring. We hear of tragic situations in neighboring St. Martin, where in Dutch St. Martin and French St. Martin combined, there are more than 80 confirmed cases of COVID. We hear in neighboring St. Martin, where they have had more than 80 cases, more than 10 people have passed away, have died from COVID-19. St. Martin was late in imposing restrictions. We had, at very early, imposed those restrictions, and we believe that that strategy has been responsible for us having the same amount of confirmed cases, COVID, as St. Martin has in deaths. We believe that to protect our people, our economy, our jobs, our nation, that we must have a very firm distancing program, social distancing, physical distancing. It is the only way to fight the spread of COVID-19 that is known to man at this point in time. There's no known cure. And if you do not come into contact with someone who has COVID, is a carrier of COVID, if you do not come into contact, you would not get COVID-19 and have, God forbid, the fate of having to pass away. It's important to understand there is some inconvenience in what we are doing, but this too will pass. And we hope when we do, we will be in a better place after that. Thank you.
Thank you, Attorney General. This question is from Von Radio, but is a question that has been answered time and time again in terms of the virus and if it's airborne and how long it can stay in the air. I would advise Von Radio to go to previous briefings that has been said in interviews with the CMO and in press briefings. Please check the information that is already there with respect to that. The question again with mask that is being asked by Von Radio, that question too has been dealt with extensively by Dr. Wilkinson, Dr. Laws, and so on, and so I will skip that question. When patients are home quarantined, does the ministry inspect the premises to ensure they have all the amenities in an isolated area of the house so they don't affect the rest of the family? That question has to do with people who are quarantined at home and what is put in place to ensure that the rest of the family is not infected. Dr. Laws.
We want to thank that individual for asking that question. Now, those who are in quarantine are thoroughly evaluated. I want us to remember that we are fighting a contagion. It's a virus, and it's highly contagious. And so much of this evaluation is done virtually. So for example, a few days ago, I evaluated one such individual. I took the time and I asked all the relevant questions about how the house is situated. Would you be in a bedroom by yourself? Will you be utilizing a bathroom by yourself? How many other individuals live in the house with you? Is there an individual who can provide you your meals and water and the bare necessities? And so I want to assure the public that as practitioners, we take the time to conduct a very robust evaluation of individuals who are quarantined to identify those whose conditions are suitable for same. And those individuals who live in situations where this is not suitable, they are removed and they are placed in government-assigned facilities. So I want to reassure the public that this evaluation is done, it's conducted, and it's robust, but we do not have to always go and visit. We can conduct this evaluation virtually. Thank you.
Thank you, Dr. Laws. This question from a citizen: a number of persons work on contracts for the various government ministries and are paid by check through the Treasury. Some of these jobs have been done weeks and some months ago and have not been paid, including some on the roof projects. And most of them are not included in the stimulus package. Is there anything in place for these persons to receive their checks from the Treasury, seeing as they cannot go out to work any jobs now and also have to feed their families? The Attorney General will take that question.
Thank you very much for that question. If there's anyone who is owed any monies from the public sector, from the Treasury, arrangements will have to be made for them to receive those checks shortly. It will not be during the 24-hour lockdown, and we will be able to have Cabinet direct that special arrangements be made for people who are owed monies, work completed, invoices submitted, processed, and if the monies are available, checks are available, these will have to be disbursed to those who need them. The government will ensure that all those who have done work for the public sector and are owed money will be paid. We have given a very comprehensive view of support to all sectors of our society. There was one question earlier, I think, that I need to quickly address, and that is those who may not be registered for Social Security in the funds that are available. And there is the Poverty Alleviation Program and the similar programs like that, that if anyone is vulnerable and unable to get any support, that these can be applied for through the Ministry of Sustainable Development, and therefore that can be added to such funds that can give you support at this point in time. We would not want anyone to be without any form of support at all, and there are a number of different safety nets that the government has put in place to address these individuals. Thank you.
This person is asking about address of people and so on who are in isolation. That is something that is basically breaches all sort of ethical and professional standards. You cannot give out people information in terms of who is quarantined and who is in isolation and all of that sort of a thing. We have to understand what we are dealing with. There's something called professional ethics, and you simply do not do that. Why would you want that information? We cannot do that sort of thing. And I am sure that I have that support from the medical fraternity as well. That is not something that can be done. Think if you were in a situation with a particular illness and that somebody gives out your information in the community, how would you feel? It's not something that is very prudent, nor is it something that is very professional. There are also some people who are making all kind of assumptions about people who are infected and all that sort of a thing, and how this person got it and from who. That sort of a melee is not needed. That is melee. And I basically do not see how that really helps the common good That does not help the common good. That does not help the public good either. That you want the juicy details of this and the juicy details of that. How is that helping the public good? It's not. This question, are drain sweepers on duty? If so, where? Because none has been seen for some time in New Pond site. Yes, Dr. Lewis.
We want to thank that caller for providing us that information. The drain cleaners, they are on duty. However, I will inform our Chief Environmental Health Officer and our Director of Community Health Services that attention has to be made in terms of that area, pond site. Thanks again for bringing that to our attention. Thank you.
Someone asks, could there be some indication as to when the General Post Office be open for the collection of registered mail? Checks and replacement credit debit cards are stuck in the system. AG?
Thank you very much. In our regulations that have been published over the last couple of weeks, we have indicated that a number of public sector departments would be able to operate from home if they can remotely, and essential services would be available for emergencies. We have heard earlier today from our Chief Water Engineer, Mr. Paris. We have heard, or should hear at some point, I believe, from the Electricity Department and others. There are some government departments that have had to work in the background, although those departments have not been open to the public. We are awaiting the advice of the health team as to when we can have, when we'll be able to do a gradual easing of the restrictions when certain departments, certain businesses may be able to open to the public. If there are urgent deliveries at the post office, someone may have had medical supplies that are urgent, that may have come by parcel post. This should be communicated to the National Emergency Operating Center here. They can get some assistance maybe from 111, who may direct them to who to call. And every effort would be made to have the particular department be able to provide for those. Any essential service, any emergency, we would do our utmost to ensure that the general public is served accordingly. We would, however, wait for gradual easing when we get the proper advice from our health team, when they've analyzed the trends in terms of reporting, of testing. We then await to have that advice that can be conveyed to the general public. Thank you.
Someone is asking about bankers. Apparently, those people who work in the bank, and they're asking why are they not considered essential workers when they still have to go out to work? No, they only go out to work on the days when I age you come.
I think, Mr. Williams, you were going down the right road. I think the Bankers Association has been a part of the discussions that we have had here at NEMA, at the NEOC, when we met with the Chamber of Industry and Commerce, representative of the Bankers Association did come. And we had made an initial adjustment in terms of the hours in those days when we had a limited curfew, that the banks would be open between 8 and midday. It would provide for bank employees to attend, if needed, to their own personal needs. We understand that some may have to do back office duties, that they may carry them past the 12 cutoff point of serving the public. As to what are essential services and essential workers, in terms of the Emergency Powers Act, there is a schedule that describes who these essential workers are. We have known the utility workers clearly. If you are without water or electricity today, internet services, broadband, is seen as an essential service, a public good, critical infrastructure. Obviously, the national security, our health workers, I think these need no explanation. And while we recognize that there are critical duties being performed by other businesses, many of them private, or most private, we deem that the essential worker is one that performs that service that as a society we cannot operate with, even on those days when there is a lockdown. We would not expect, for instance, a bank officer to be working on a Sunday, on a public holiday today. But if your water main bursts today, water department officers have to go and fix it. If the electricity goes on a Sunday, we expect the skeleton workers to come out and fix those. That's what makes them essential. The nurses work 24 hours around the clock. So too do doctors. These are essential services. Our police man the roads that protect us every day of the week, every hour of the day. This makes them essential. And so there is a distinction between what is essential and what are important functions to keep us going. And while we recognize that bankers, bank workers, and others do important functions, we would want to ensure that we recognize it and commend them for the work they do, but not to overburden our processes with those who do not hold a special critical role. I understand that the question really, maybe I'm drawing more than I should, but it seems to suggest that there are individuals who may be having some difficulty in those hours set aside when those who are deemed to be the essential workers can access certain services such as food. And special hours have been identified at one time early in the day, now later in the day, for essential workers to have that time to go, a small gap, to go and do their shopping, for instance. If we start to crowd everybody into that, there's no special rate of that. We are reviewing other proposals, and these will be communicated shortly when it comes to how we can better serve everybody in terms of getting access to food retailers and other services that we need to keep our lives, our families going. Thank you.
You know, while we might not be able to visit people who have contracted COVID-19 because it's a highly contagious disease, that does not mean that we cannot pray for them. We can pray for them, and always remember as well that they must not be discriminated against, or there must not be any sort of a stigma in our society against people with COVID-19. Many persons contract the disease unknowingly, and that is why the medical professions are saying we must take personal preventative measures and also practice social distancing and proper hygiene and all of that. We don't want a society that is cold and uncaring by stigmatizing, something like what happened a few years ago when you had the HIV. You had a lot of discrimination and stigma. So we need to have a lot of education in terms of not discriminating and stigmatizing against or scorning people, but really praying for people and being a compassionate, and because any one of us can contract the COVID-19 virus. Right. This question has to do with the results that come from CARFA. And the person's question is, why it is that we're just getting 1-1? So I need Dr. Laws to explain that CARFA has to report to the World Health Organization and PAHO the results. Dr. Laws.
Okay. Mr. Williams, I am still trying to understand that last question in terms of receiving results 1-1. If my memory serves me right, day before yesterday we would have gotten back 7 results from CARFA, and we would have gotten about 20 results from NextGen all at once, and they were all negative. And so we receive results from both laboratories in bulk based on how many samples have been shipped. And I am happy to tell you that we only have 12 confirmed cases. Yeah.
I just want to add something, because since someone spoke about the United States and Dr. Fauci earlier, one of the things he said this morning was that they need to start doing contact tracing, because they've been focusing on the number of persons diagnosed and the number of persons who were dead, but they haven't started doing any extensive contact tracing. We are one step ahead of that. We are, for the 12 cases that we've had here, we have extensive contact tracing, to the point now where we have persons who are quarantined because they were found to be a contact. And if we're at the point where we are just complaining about the quarantine facilities, it still means that we are ahead of the game. And I believe we need to start looking at the positives, because the first case was diagnosed on the 25th of last month. And we are now more than 1.5 incubation period into the disease being in St. Kitts. And if things were out of control, we would have had a significant number of cases presenting to the hospital with symptoms. As yet, we don't have any persons admitted to the Josephine France Hospital or the Alexander Hospital. In our 3 health institutions, we are not seeing a lot of persons with any flu-like illness. On average, we see at least 2 to 3 persons per 24 hours in the flu-like section at the emergency room, and most of these persons, they are not necessarily having symptoms related to COVID-19. So I believe we need to start seeing the glass half full rather than half empty, And what I want to do at this point in time is to say to the healthcare workers who are out there who can't lock themselves away from this COVID-19, and they have to be out there on the front line, putting themselves and their family at risk, keep up the good work and continue doing what you're doing to keep our country safe.
Thank you, Dr. Laws and Dr. Wilkinson. This question is about Western Union. Why is Western Union not open when the banks are open on partial curfew days? Western Union in the United States is open and persons would like to collect funds sent to St. Kitts. As far as I know, the regulation provides for money services to be open, which just like the banks, and also Western Union is a multinational. It's a multinational company. So, I mean, I don't know. That is a question for Western Union itself, because it's a multinational company. It does not have its headquarters here. It is here, but it's not a local company. And the regulation provides that money services be open. Someone asked this question, I think Dr. Laws is for you again. How many cases have been rejected by CARFA? Are they included in the negative numbers provided in the statistics?
We want to thank you for that question. Based on my information, there aren't any samples that have been rejected by the Caribbean Public Health Agency. And so I want to underscore that the Caribbean Public Health Agency has not rejected any samples. However, I must add, there is a case definition that's provided to us by the World Health Organization, and the Caribbean Public Health Agency is only processing samples of for symptomatic patients or persons. All right. However, they have not rejected any samples. Thank you.
The evidence is showing that countries that locked down early, like South Korea, for example, New Zealand, these countries, you haven't seen a spike in infections. However, countries that took the threat lightly, and we are seeing that country now, the number of deaths and the confirmed cases is the most in the world. And we know that that country is the United States. That country is the United States. So when people are asking about President Trump and Dr. Fauci, that really should be the response that should be given. Dr. Laws.
So, Mr. Williams, I wanted to add, Caribbean Public Health Agency utilizes the gold standard, the RC-PCR antigen test, and so does Next Generation Lab. A positive result indicates that they have identified the virus in a particular sample. A negative sample indicates that no virus was found in a particular sample. And I said before, neither of the two labs have rejected any samples. And so our 12 confirmed cases, the virus was found present in their samples. Of all the negative cases that we've reported, viruses were not found in their relevant samples. And so I just wanted to, explain a positive result versus a negative result. And to date, neither of the two labs have rejected any of our samples. Thank you.
This is our last question for the day. I heard that Mr. James is not with you today. He is not. Therefore, I don't know if anything one can help me with in terms of the time when livestock farmers are allowed to visit their farms, because I am getting different times. I really didn't hear it for myself. Superintendent?
I think we've been answering that question for some time now. Livestock farmers, they're permitted to tend their animals between the hours of 7 a.m. and 9 a.m. daily on curfew days.
I want to thank you very much for your questions today and hope that the answers that you received will help you in terms of your knowledge and how to go about handling the COVID-19 virus and the state of emergency that is in place. I would like to thank Dr. Ismay Taylor for her donation. Of course, it's always when somebody can come and donate at a time like this, it is very, very important because there are needs to be met. Mr. Charles Parrish from the Water Services Department, and we understand at this particular time how crucial water is, because this is a disease where we have to practice hygiene, washing hands, washing down surfaces, and so on. We thank our Chief Medical Officer, Dr. Hazel Laws, who continues to be here and who continues to answer questions, sometimes over and over and over and over again, repetitiously. And Mr. Abdia Samuel, Chair of the COVID-19 National Task Force. We want to thank you very much. Thank you, Dr. Cameron Wilkinson. Thank you, the Honorable Wendy Phipps, the Honorable Attorney General, and our Commissioner. Thank you to all of you for tuning in and joining us today. ZIZ would like to know there was a break in transmission. However, the live conference will be carried, or it will be rebroadcast rather, on ZIZ at a later time today. Thank you very much, and see you tomorrow at 5.